I'm Dr. Kendra Parrish. I'm a general surgeon. I trained in New Haven, Connecticut, and then after that went into practice in Maine, and then moved to North Carolina just over 6 years ago. I've been in practice at UNC Health Southeastern for the entirety of that time. My focus is on endoscopy, so upper endoscopies and colonoscopies, as well as breast cancer treatment and treatment of benign breast disease. Detecting breast cancer early is beneficial for multiple reasons. With detecting something early, there's certainly a probability that there can be less extensive treatment needed as compared to if something is diagnosed 2 or 3 years later when someone might need significant treatment to handle disease that is spread out of the breast and into the rest of the body. For breast cancer screening, most organizations recommend starting at age 40 and doing a mammogram or mammography on both breasts every year. And certainly if there was an abnormality picked up, this would change the course, or we may do ultrasound or breast MRI as well. But for the majority of the population, starting at 40 and continuing every year would be what is indicated. There are special situations, so if somebody has a family member, first-degree family member, such as a sister or brother or parent that has been diagnosed with breast cancer, that you would start at an earlier age. Or if you are diagnosed with a genetic mutation, which increases the risk of developing breast cancer in the future. Most people would not start before the age of 25 for mammograms. Again, those are a small percentage of the population, and usually it is age 40. Each year, we ceremoniously light a pink ribbon atop UNC Health Southeastern in observance of October as Breast Cancer Awareness Month. The ribbon remains lit throughout the month as a reminder for women to participate in screenings in the fight against breast cancer.
Hi, I'm Dr. Peterson. I'm the medical director for the radiology department, and I'm also the director of the Women's Center. We're here to talk to you about breast cancer. October is Breast Cancer Awareness Month. As of today, 1 in 8 women will develop breast cancer in their lifetime. 1 in 8 worldwide. Just last year, 2.3 million women were diagnosed with breast cancer. Today, almost 8 million women are living with breast cancer that have just been diagnosed in the last 5 years. Those are some staggering numbers. Out of all that, is there anything positive? There absolutely is. Of those almost 8 million women alive today with breast cancer, only around 8% of those patients succumb to the disease and pass. So breast cancer in and of itself is the most prevalent cancer in the entire world out of every cancer, but it has one of the highest survivability rates. Why is that? It's due in part to early detection. The earlier we find a cancer, the easier it is to treat. If we find something when it's very early on, it can be treated with local resection and sometimes radiation. If it's past that, then you move into things like chemotherapy, mastectomy, radical mastectomy. But even then, in most of those cases, those patients, while they go through treatment, they don't end up succumbing to the disease. That's globally. What are we doing locally? I'll tell you. Last year, we did over 13,000 examinations. 10,000 of those were screening mammograms. Out of that, we found over 80 cancers. 80, that puts us at 20% above the national average. How are we doing such a better job than the rest of the country finding these cancers? I'll tell you, it's 2 things. 1, we have fantastic personnel. They're amazing. 2, we have some of the most cutting-edge technology that's available. I'm sure many of you have noticed over the last couple of years the integration of 3D tomosynthesis, and that's basically 3D imaging of the breasts integrated into your regular annual mammogram. Traditionally, on a 2D mammogram, we get 2 pictures of each breast. With tomosynthesis, it can be up to 500 images. We're getting that many images. We're able to find very small cancers much sooner. In the last year, we've added breast MRI, breast MRI is the most advanced imaging you can do for the breast tissue, okay? Now, there are generally two scenarios that we would use breast MRI. One is in a diagnostic situation. We have a patient that comes in and there's something that we see on mammogram and we see it on ultrasound, but we're not able to completely characterize it and we're not sure, is this something we need to do a biopsy on or is this something that can be followed up? We can do a breast MRI and that can give us a much more accurate picture of the tissue and tell us, okay, hey, this is something that we need to be worried about. Let's do a biopsy, or this isn't something to be concerned about. We can follow this up at 6 months or even 1 year. The other situation is patients that have a high risk of breast cancer. Those are patients that have a greater than 20% lifetime risk of developing breast cancer, okay? Some of those are patients that have strong family history. But what about the other patients? What about the patients that are average risk or intermediate risk and they have concern, but they don't meet the qualifications for a traditional breast MRI? What we've developed here at UNC Southeastern is what we call a fast breast MRI. It's basically an abbreviated or shortened MRI. Contrast is still given. We're still able to get a very, very clear depiction of the tissue, but instead of a 35 to 40 minute exam, the patient is only in the scanner for 15 to 17 minutes, so it's a much shorter exam. And even though it's shorter, it has a 97% sensitivity and 99% specificity for finding cancers when compared to the traditional breast MRI. So it's a fantastic examination. It's something that we offer here at UNC that very, very few institutions in the area, in the state for that matter, offer. Not only that, the hospital has managed to make this available at an extremely affordable price. For cash pay patients, it's the same price as a breast ultrasound. And I can tell you, having worked all over the country, I have not seen that anywhere. It's usually 2 to 3 times or more. So they're very, very dedicated to getting this out to the community to help with cancer detection.